Good evening and welcome to IFW Council's special web series on women's health. I'm Anisha Nair-Thavan and you're watching our exclusive show on women's care during COVID-19. The ongoing pandemic has raised serious concerns amongst everyone, and women are certainly facing the brunt of it. The impact of this virus on their pregnancy, childbirth, family planning, or more regular and common needs such as menstrual health, nutrition, or mental health are among those issues that are bothering them. And there is one more thing that is causing immense suffering to many, and that is the inability to conceive. Infertility over the years has emerged as one of the most common health issues being faced by couples in our country. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of India's population. And the scenario is worse in the cities where every 1 in 6 couples is affected. Our show today is special as we're going to discuss all aspects related to IVF and infertility. And to guide you on that and to answer all your queries on this subject, we have with us Dr. Priya Varshney, IVF and Infertility Specialist, Cloud9 Hospital, Gurgaon. Welcome to the show, Dr. Priya.
Thank you, Anisha. Thank you. It's an honor to be on the show.
Now, before I begin the conversation, I would request our online viewers to send us their queries. You can type them in the comment box, and Dr. Priya will be most happy to answer all your questions over the next 30 minutes. Do like our page, comment with your feedback, and share this page with your friends and family if you think they could also benefit from all that we will discuss today. So let's begin, Dr. Priya. Now, the infertility problem is increasing in our country. We are seeing more and more couples coming in for infertility treatment. Is IVF the answer for all the problems for infertile couples?
See, Anisha, what happens that infertility, what we define is as failure to conceive after 1 year of unprotected intercourse. So if you talk about, it may arises from, a couple may not try for 1 year, and if the woman is elderly, like more than 35 years of age, we label as only 6 months of trying and to be subfertility. Now we call this as subfertility, better than infertility. So there are many causes for that, and it's not about that IVF is the only solution. So we have, depending upon the severity of the disease and the causes related to it, we have different type of treatment options for that. So initially, what we do is that we first understand the situation, that what is the problem in conceiving. At times there is mild only stress and unawareness and not knowing the proper reason. So this correcting these only will help the infertile couple to conceive. But in few cases there are particular problems, like they are having any disturbances in ovulation, they are having any defects in tubes. So accordingly, depending upon the disease, we try for them treatments. So initially we try for milder drugs, milder treatment option, and if nothing works for that, then yes, we advise them for IVF. But yes, in few cases, if we talk about, there are certain reasons that where the couple cannot conceive naturally, like if there is no sperms in men, or if the tubes have blockage, or if there are decreased number of eggs, then yes, in those we might take up IVF for as a first line of treatment.
Dr. Varshney, you mentioned stress as one of the reasons why couples face issues of failing to conceive. How does this work? Everybody is stressed. We're all running around. We've got deadlines to meet. Does this actually impact conceiving as well?
Yes. So now what happens that the subfertility problem is rising, and especially 1 in 4 couples, if we talk about in urban or metros population, they are suffering from the subfertility. And the main reason what we are encountering in our practice is that couple don't have a time to stay together and during their fertile period. So everybody is in their run for maybe their profession, their work stress. Whatever they are doing is that they are not giving time for their their normal life to be in a proper place. So this is one factor where we are facing, we are finding more and more couples having this problem. And main, when we correct those things, when we try to correct for this, these stress things out, and the things happens naturally in majority of cases. What happens that stress plays a major role because the pregnancy, or what we call as the implantation, it is a
Mm,
balance between multiple factors. And
mm,
this multiple hormonal balance is mainly governed by the stress and by the by the endorphins which we have in the body. So
mm.
stress infect those endorphins, stress affect those implantation process, and stress affects the physiology of implantation. And that's why majority of couples do affect by this who are affected by stress, having faced, say, this for fertility problems.
So you're saying stress impacts the hormones in the body, and that impacts your chances of conceiving.
Perfect. It actually doesn't impact the hormone. It just disbalance the balance whatever we needed during implantation.
Okay.
For the embryo to implant, we need a certain balance of the hormones in the body, and
Mm,
due to which the implantation process get disturbed, and hence there is no pregnancy. Also, the stress affects the ovulation. Also, at times we
mm,
see that the woman is not ovulating, and we just correct the lifestyle, we just give her mild drugs and she start ovulating. So this
mm.
is where in every step of pregnancy, or in every step of implantation, stress or the happiness or well-being plays a very important role.
So if you think that you're presented by a couple that doesn't seem to have any medical reason for infertility, perhaps stress is the reason, then what is your prescription? What should they do? How should they de-stress?
See, first is that the one who are trying to conceive, the couples who have decided to extend their families, they just first aware of that what is their fertility cycle, what we call as a fertile period or a fertile window. So first, what we do is that we counsel any couple who are coming for the advice. We counsel them for their fertility window. We tell them about their ovulation period, we tell them about their fertile window, and we tell them about all those lifestyle modifications. There are many factors which should be controlled before woman is planning to conceive, like her lifestyle is diet, her body weight, her drinking and smoking habits, her sleep habits. So these things first we take care of these habits. We ask the woman to control on these factors, and once these are controlled on these factors, then we prescribe them few drugs, few supplements, few vitamins, few minerals, and then within that things out, the majority of couples to conceive with this prescription only.
That's great. De-stressing could be a very important part of your fertility journey, of your journey to conceive. But our talk with doctors has also shown us that, our lifestyle sometimes also come in the way of, the smooth journey of starting a family, especially when our healths are not optimum. So, does this also play a role in, getting pregnant and carrying the pregnancy to term without problems?
Yes, so this is the area what we call as a preconceptional counseling or preconceptional checkup. So what we do in this is that whenever a woman think of extending her family, she visits or she should visit a doctor or fertility specialist to consult that what are her body status, whether her body is healthy or not. So there are certain pre-conceiving investigations which we advise for a woman, like what is her hemoglobin, what is her blood sugar, what is her thalassemia screen, what is her the other status like rubella immune status. And so these things are some preconceptual tests which we advise for a woman when they are planning to extend. And number two, we do supplement them with a prenatal vitamins. So what is like folic acid, what we give
Mm,
is normally as a prenatal vitamin to avoid any pregnancy
okay.
complications or any birth defects to the baby. So these things, and those who are having, we just take a proper history about their lifestyle. Suppose some females are overweight or obese, so
Mm,
they do affect also their pregnancy
okay.
journey. So we ask them to control their weight, we take their diet schedule, we take their other habit status, like some are chronic smokers, some are chronic drinkers, so they also do affect their pregnancy journey. So these things we modify them, we counsel them for on these aspects, and then we ask them for conceiving, so that a better better healthy body only can carry the healthy baby till term. So if a body is not healthy, there might be any other complications also during pregnancy.
Right. Dr. Vashni, we started getting a few questions, and the question we are getting is from a Facebook user who's asking how to conceive with low AMH. For the benefit of everyone, if you can explain to us what is low AMH and how does it impact the chance of getting pregnant?
Okay, so what does AMH is? AMH is known as anti-Mullerian hormone. So
Mm,
this is basically a blood test, and this test detects the how is the ovarian reserve of a woman. So
mm,
a woman is born with a fixed number of eggs at birth. And these eggs, as the time progresses or as the age advances, the number of eggs basically declines every month. And due to this ovulation process also. And at the time of menopause, all the eggs normally get exhausted. So as and this process of declining actually get expedited after 35 years of age. So we wanted to check, if suppose we wanted to check a female at a particular age, that how
mm,
is her ovarian reserve status, how is the number of eggs in a body in a woman. So we check those number of eggs by few tests. So one test is via ultrasound. We check by which is called as antral follicle count. In the
mm,
ultrasound, we check the ovaries, we check the number of eggs. And second test is that we correlate them with the hormonal test. So that is known as AMH. So the AMH value is basically what happens when, as the age advances, the value of AMH decreases. But in some women, I told you that in some women, the process of this declining, this extinction of this eggs get expedited. So some women might have a decreased AMH also, which cannot be justified by their age. So
So you're
this is
saying even
basically,
at a younger age, they have lesser eggs?
yes, they may have. So this is what we call as premature ovarian insufficiency,
Mm,
where there due to some disease process or due to some immunological reason or some genetic reason, a woman at a particular age does not has a that number of eggs that is required for an age. They
mm,
had decreased number of AMH and decreased number of eggs depending upon their age. And those
mm,
are the women who are very challenging because they are very young at times, 25,
mm.
26 years of age, and they don't have eggs in the ovaries. So this is also what, that's why the role of that whenever a couple wants to have a everything, or maybe they are not planning to have a children at all, but still they should get their whole body checkup done so that there is not a emergency thing they are dealing with.
Ma'am, another question related to AMH is what is a good AMH level to get pregnant, and what affects your AMH level? Could there be, factors that we do impacts our AMH, or is it predefined, or just bad luck if it's low?
So any AMH, if we call as a reproductive age group, any AMH above 2.5 is normal, and
Hmm.
1.8 is a bit borderline, and 1.5 is a critical value. So this is also, I told you that it is also dependent upon the age. So this I told you is that the normal reproductive age group AMH that should be there in a woman.
Hmm.
Yes, if we talk about that, AMH is basically genetically determined. So this
Okay.
is not something which you can alter basically by the
Hmm.
drugs or by the medicines or by the diet and all. But yes, you can improve a bit by some supplements or some medicines. But studies shows that there are not major any treatment breakthrough that helps in improving the AMH. It is
Hmm.
basically the genetic thing of a.
Predisposition. Okay. So it's passed down. So don't blame yourself because there's nothing which you have done that has reduced the MH. Don't blame yourself. Okay. The next question we are getting is, do fibroids in posterior wall affect fertility?
Um, Fibroids are basically the uterine tumors. Basically, they are the overgrowth uterine muscles, and they can, if there are many types of fibroids, like there are three types of basically fibroids depending upon the location. They might be in the muscle, they might be inside the uterus, and they might be outside the uterus. So basically, we should know that what type of fibroid is it, whether it is inside the uterus or what we call as inside the uterine cavity, which we call as submucous fibroid. The another is inside the muscle, what we call as intramural fibroid, and the third is subserous, that is outside the uterus. The second is the location upon the fibroid, like one is anterior and one is the posterior. So first we should know that what is the type of fibroid, even though it is posterior fibroid. And secondly is the size of fibroid. So these two things have, and what we do is that nowadays there are fibroid mapping scans, 3D fibroid mapping scans. There we do what is that we map the fibroid, that where is the exact location of the fibroid, even though it is in the posterior wall. It's a very big term. So we just has to localize that where is exactly the location of fibroid, the size of fibroid, and the position where it is occupying in the uterus. That determines that whether it is impacting your fertility or not.
Ma'am, the other question is, what can aggravate fibroids? Okay, again, this question seems to come because, whenever women have some problems, they tend to blame themselves. Oh, we must have done something wrong. So in case of fibroids also, could women have done something wrong to bring it on?
So the same thing actually, fibroid is also not something that to be blamed of. It is more of a genetic component, and plus some hormonal disturbances also govern their growth. So if you talk about, there are some conditions where there might be increase in the fibroid, and there are some conditions where might be decrease in the size of fibroid. Like after menopause, the fibroid normally do shrink, and during pregnancy, the fibroid normally do increases in size. And suppose if you are on any pills that can control the size of fibroid, but they exactly cannot increase or decrease the size of fibroid. So you can control their progression, but except surgery, you cannot modify any factors which can improve the size or decrease the size of fibroid.
So the question then is, coming from a Facebook user, can fibroids affect the baby's growth? You said that during pregnancy they tend to become bigger. So what happens to the baby who's in your womb?
So again, the fibroid complication do depends upon their size and their location. So if there are a small fibroid inside the uterine muscles, or maybe the outside the uterine muscle, it normally don't affect the pregnancy as such. There might be slightly increase in the size of fibroid, and that can be manageable with the things out. But yes, if the location is like something inside the uterus and they are in that place where the baby implants, then yes, they might lead to pregnancy complications also. They might lead to miscarriages also. And at times, the very big size of fibroid when they are inside at the junction of uterus and cervix also. So that time they might hamper the labor process also. So the majority of the things depends upon what is the size of fibroid and where is exactly the location of the fibroid. That determines the fertility and the pregnancy complications.
Right. Ma'am, another question that is coming is, what are treatment options available for infertility other than IVF? You said that, you prescribe them milder treatments, milder drugs first. So what are these till you come to IVF?
So the first treatment, what we normally give, first I told you, is that lifestyle modification. The second, what we give is the ovulation induction drugs. So what we do is that we give some drugs either in the form of oral medicines or injections for ovulation. Those who are having ovulation disorders or polycystic ovaries, there we give some medicines for inducing ovulation. And we ask the couple to be together during their ovulation period. The second thing is what we do is that if it is not successful with the ovulation and timed intercourse, what we call as, then second step is what we do is that ovulation induction drugs plus IUI. In IUI, what we do is that we take the husband's semen and we process it we separate the motile and good sperms, and we push those sperms inside the uterus of the
Of the
woman.
woman.
So it improves, and from the normal conceiving, it helps improves the success of the conceiving in this by this IUI. The third option, what we do is that at times when there is a problem, like I told you, there is a tubal problem, tubal blockages, or maybe some fibroids, or there may be some endometriotic cyst, there might be some endometriosis. So in those, what we, if we think like that there might be a problem, that this might have hampered her fertility, so we might go for a laparoscopic correction of these problems.
Hmm.
So, and after that, that if nothing works out for the woman and everything, does not give the success, then only we take a couple for a IVF.
How do you determine what is the reason for infertility when a couple presents themselves to you?
So first, actually, when a couple of fertility problems comes to us, first we assess the couple by various fertility investigations.
Hmm.
So the three major things what we need for a fertility is, number one, there should be ovulation happening. Number two, the tubes, whatever we call as fallopian tubes, they should be
Be
patent.
open.
And number three, the sperms count should be enough and they are good motile enough to reach that eggs. And number four is the uterus must be healthy to implant that pregnancy. And above all, there must be a balance of hormone status in the body that they can hold that pregnancy. So there is a combination of all these factors which leads to a healthy pregnancy. So we
Hmm.
assess by different tests, like for ovulation, we check it by ultrasound and by some ovulation kits, whether the woman is ovulating or not. By for tubes, we test the tubes by tubal X-ray or by ultrasound. For sperms, we check the husband's semen for semen analysis to check for how is the count of the sperm and what is the motility. And for overall assessment, we check some hormonal tests, whether her body is perfectly okay or not to take over that pregnancy. If we find that everything is perfectly normal, then we start it as a for that. So we go for a thorough investigations of both husband and wife when a couple approaches us for a fertility problems.
All right, a thorough investigation is done before charting out the course of treatment. Now, how often do you see, the problem lying with the partner, the male partner? Because most of the times women tend to blame themselves, and because you said, like, the clock is always ticking against them. If they wait too long, it just becomes too long. But how many times is it the male factor that is the reason for infertility?
So nowadays the scenario is that we are getting more and more of male infertility problems, and especially in the urban population where there is a lot of stress and lifestyle factors are there. So if you talk about that, 40% of all infertility problems we are attributing to now the male infertility, and this is either in the form of any sexual dysfunction also. This might be any problem with the sperm counts also. There might be any problem with the sperm motility also. And at times we found that there are no sperms in the semen. And that actually a man cannot know that until
Hmm.
and unless he's being tested for that semen analysis. It might not have any symptoms also. And there are sometimes some hormonal disturbances also, which can lead to this male infertility problem.
Right. So, ma'am, when we talk of these diagnostic, tests, are these non-invasive? Are all of them non-invasive?
Yes, so the thorough assessment basically goes first and foremost by a semen analysis test. That is
Hmm.
that a husband has to give their semen sample, and the andrologist check for their semen count and motility. And others are in the form of blood test or maybe ultrasound, so that denotes that how is the size of everything, testis and scrotum, how is the hormonal test, how is the testosterone level. So these all things tell us about the male fertility status. So the irony is that at times that male infertility is very subtle. They don't know that they are having a problem.
Mhm.
One form that they know is about comes in the form of sexual dysfunction when they have a sexual problem. Then only they come to know. Otherwise, in a majority of cases, when they have no sperms or decreased sperm count, there are no symptoms for that. So they are not aware that they are having any fertility issues or not.
Right. Ma'am, another question from a Facebook user has come. For a condition of stenoteratospermia, where do you go? Whether would you go for IUI or ICSI?
So first is that asthenoteratozoospermia is a problem where there is a decrease in the motility of the sperms and plus there is an abnormal morphology of the sperm. So if both of the factors are affected and the it actually depends upon how what are they are grading also of this asthenozoospermia and teratozoospermia. So we have to look about that minute details of that. But yes, if teratozoospermia is there, like if morphology is impacted, then yes, definitely then IVF is the mode of treatment. IUI will not help in those cases. If there is only asthenospermia, like motility is hampered, so if there is a mild grade 1 asthenospermia, then we might offer IUI in those cases. But along with that, if there is a teratozoospermia, then yes, IVF will be the mode of treatment for those type of couples.
All right. Ma'am, another question that we have received from a Facebook user. Ma'am, can you throw light on a condition called hydrosalpinx and its role in infertility in women?
So hydrosalpinx is a problem that where there is the tubes are blocked and there is a collection of either water or infected material inside that tube. So when there is the tube become distended and dilated with that collection, we call this a hydrosalpinx. Hydro means water and salpinx is the tube. So this is the dilated tortuous tube. So what happened is that I told you that for a normal fertility to occur, that the tubes should be patent, even though a single tube patent is also enough for the pregnancy. But when there is this is basically a tubal disorders, when there are tubal blockage which become more severe, then start forming, collecting water inside the tubes, and it it hampers fertility also, and basically it hampers the success of IVF also. So these hydrosalpinx first should be treated first, confirmed by some 3D scans. And if there are the hydrosalpinx, we first give them some medicines to correct that. But if still not there, then what we do is that we do go for a laparoscopic surgery. First, we try to drain them out. If it is possible to clear them off, it's okay. Otherwise, what we do is that we normally ask them to clip them. Basically, we remove them because they are not the healthy tubes; they are the diseased tubes. And if we do IVF also with, because these couples normally require IVF for that, and if there are hydrosalpinx along with that IVF, it hampers the result of IVF also. So we normally do when we do the laparoscopy for pre-IVF laparoscopy for them, we normally remove these tubes if they are not healthy.
Right. Ma'am, one more question coming in from a user is, what's the difference between ICSI and IVF?
Okay. So what we do is that in IVF, basically, where there is we stimulate the ovaries for the multiple number of eggs, and then we take out those eggs from the ovary with the help of ultrasound, and we keep those eggs in the IVF lab, and we observe them and clear them off. After we extracted those eggs in IVF means in vitro fertilization. Here, what we do is that in a dish, we keep those egg and sperm together in a dish, and we look for a normal fertilization process to happen. And the fertilizations normally occur naturally between those egg and sperm. So this is in vitro fertilization. What happens in ICSI? ICSI is ICSI. What we do is that we take one sperm, we take one egg, and we fertilize them with the help of a microscope or a micro manipulator. So there what we do is that we inject that sperm inside the egg. We manually fertilize it.
Okay.
So that is known as ICSI. And we do it in those cases where we have a doubt that sperm has not the ability to fertilize the egg by itself. So this is an advanced process of IVF where we inject the egg with the sperms manually.
Right. Ma'am, another question coming in is, how long does it take to get pregnant with IVF?
How long? So this is actually a broad question. So what happens is that IVF cycle, if we talk about a single IVF cycle, so that's spread over around 14 days. It starts from day 2 of the period, and
Mm,
we do it complete by around day 15 of the period when we did the embryo transfer.
mm,
After that, we wait for 14 days for the result to happen. In majority of the cases, is everything is perfectly normal. The success of a first attempt of first transfer, of first IVF is around 50 to 60% in a usual scenario. Suppose if it does not happen in the first attempt, it's not always that if it does not happen in the first attempt, it will not happen in the other events also.
mm,
So what we do is that we transfer normally 2 embryos or maximum 3 embryos in one attempt, and rest of the embryos we freeze them, and later on, what we do is that we transfer only those frozen embryos. So
mm.
we can take multiple attempts also with those frozen embryos if we have enough number of embryos with us. So it's not like that first attempt the success is 60%, then another attempt it will be less or it will be more. It all depends upon what went wrong in the first cycle, and how we can correct it. If we can correct it manually, then the chances of consecutive events are perfectly fine, or better than the first event. So at times people don't need another events. They just conceive with the first cycle, and later on they freeze their embryos and they use it for their second pregnancies also.
Okay.
So this is not the thing that how many attempts. At times they don't need require more than one attempt.
How do you determine what are the factors that lead to the success or failure of an IVF cycle?
The success of basically IVF cycle depends upon the multiple factors. The major determinants are: number one is the quality of eggs, quality of sperms, quality of embryos. So these are the what we call as seed soil concept. A healthy seed can only implant in a healthy soil.
Mm,
So first is the quality of embryos, and second is the quality of that uterus or the endometrial thickness where we have put those embryos, and third is the body hormonal status. So these things basically, these are the major three events which determines that success of IVF. So if when we do our IVF, at times it not only tells us about all these things in details. If our IVF is unsuccessful, it tells us that what might have been a wrong, what might have went wrong in the cycle that leads to this unsuccessful IVF. So at times we see poor quality embryos, at times we see poor uterus or poor endometrium. So these things actually we correct in the second cycle, and it leads to then further
right. So there could be many reasons, and you're saying that most of the times, even before going in for a cycle, you would know what are the factors impacting the chance of success of a cycle, right?
yes, yes.
So, ma'am, when it comes to the frozen eggs, and say just for assumption that a couple does not conceive on the first try, even though their success factors were in their favor, all the three that you have mentioned, then, ma'am, would you say that a frozen cycle stands a better chance? Because here in the frozen cycle, you will not stimulate the women to release her eggs. It happens in a natural process, so hormones are completely in harmony. And hence, when you introduce an embryo, the embryo has a good chance of implanting.
Yes, there are multiple studies which suggest that the frozen cycle results are a bit better, but not very high, but better than that fresh cycles. So initially, what happens that we didn't have that freezing technique. So because at times the freezing techniques also should be perfect for freezing these eggs and sperms, because they are very delicate. They
Mm,
cannot bear the stress of all those freezing also. So the main chunk is that the technique by which they are got freezing in the expert hands, they are also very important when we decide for a frozen cycle as compared to a fresh cycle. If we make this thing constant, then yes, if we say about that frozen cycle results a bit better than fresh cycles.
all right. Thank you so much, ma'am, for joining us today and answering all the questions that you've taken up. It has been very enlightening for all those who have tuned in and asked you questions as well on, what is the journey of fertility treatment? Where does IVF stand? What does it do? how IVF is different from ICSI. Thank you so much for answering all the questions that you've taken up today. Thank you.
Thank you. Thank you for your kindness, divisions. Thank you.
So that was Dr. Priya Varshney from Gurgaon answering all your questions related to IVF. This was the last show of our Women's Care Series, Season 2. We will come back with more special shows on women's health soon. Do follow us on Facebook to get all the updates on our upcoming programs. And this program was supported by Bharat Serums and Vaccine under its Public Awareness Initiative. Don't forget to follow us and stay updated on all that concerns your health and well-being. Till then, goodbye and stay safe.